My name is Gregor Smith and I am Scotland's Chief Medical Officer. I'm pleased to be introducing my annual report, Realistic Medicine, Taking Care. We continue to experience a much more uncertain and volatile world. The accumulation of events that bring about this insecurity, the global pandemic, conflict-related humanitarian disasters, and the energy and the cost of living crisis have compounded existing challenges and rattled the resilience of health and care systems across the world. On top of this, the most significant long-term threat to human health remains the climate emergency and its impact on planetary health. It's clear to me that health and care professionals globally must use our trusted position and our influence to help us to mitigate and adapt to the planetary crisis with greater urgency. Despite this uncertainty, I remain optimistic that we can meet the four concurrent challenges to population health in Scotland: the ongoing threat of infectious disease, the widening health inequalities, the need to create a more sustainable health and care system, and the need to address the planetary crisis. I remain optimistic because I continue to be struck by your dedication, your kindness in working towards a sustainable future. Last year, in my annual report, Doing the Right Thing, I spoke about the way that we deliver care. I shared my thoughts on the need to resist the industrialisation of care because this leads to generic and transactional relationships between professionals and the people that we care for. The industrialisation gets in the way of human connection, which is fundamental to the art of caring. This year, I'd like to develop this theme further. I believe that by nurturing trust, by understanding both the biology and the biography of the people that we care for, we can make meaningful connections and deliver careful and kind care. Importantly, it will help ensure we deliver the outcomes that matter to the people that we care for. Mitigating and adapting to the planetary crisis must be our number one concern as we work towards a climate resilient, low carbon, equitable and sustainable health and care system of the future. And I will discuss why we must act quickly, collectively and decisively. We must also continue to embrace innovation. It's central to the pursuit of well-being, equity and Scotland's wider socio-economic success. This year, I am thrilled to be celebrating our proud tradition of research and innovation and the 50th anniversary of the Chief Scientist's Office. I will also share my reflections on our progress towards improving lives in communities across Scotland and beyond. In his recent report, the Auditor General highlights the challenges that our system is facing. He identifies value-based health and care as an opportunity to address them and recommends that government and health and care professionals must work together to deliver it. He's emphasised the need to empower our colleagues to practice realistic medicine and to recognise how it can impact positively on outcomes and sustainability. I hope that this report, which focuses on people, on the planet and on progress, will resonate with you, lead to further innovation and new and sustainable ways of working. And I very much hope it will help us connect in a meaningful, human way with the people that we care for across Scotland.
I'm Dr. Deepa Shah and I'm a GP working in Shetland. I'm part of a healthcare worker collective called Greener Practice, which aims to improve the sustainability of the healthcare that we provide to our communities. Climate change will affect everything. It is the defining issue of our future. However, for a lot of people I speak to, climate change is this abstract concept, and you can totally understand how people don't see how it relates to our health. The climate science is clear, and we're already seeing the impacts of climate change with the extreme heat, flooding and storms that we've had across Britain in the last few years. The ice and snowstorms that we had in Shetland last winter, where 5,000 homes were cut off from electricity for up to a week, is just one example of some of the challenges that we're increasingly facing, and this is just the beginning. The future is really unpredictable, and the impacts of climate change are only going to rise exponentially unless we have a plan and act on it. I believe that we can create a healthy society that protects our planet and safeguards the health of future generations. Climate change is a global issue, but we need a local response in each and every community. What drives my passion for greener practice is that this local response is one that can transform our communities so that they can become healthy and fulfilling places to live. We have an opportunity now to step back and consider how healthcare can support individuals, families and communities to thrive and flourish, not just in treating disease, but in providing meaningful care and setting the foundations for good health. Prior to moving to Shetland, I worked as a doctor in South Africa at the height of the HIV epidemic. I then returned to the UK, where I worked as a GP in inner city London and with a charity in refugee health. All these experiences showed me how health is shaped so much by social and political factors. For example, how things like access to HIV testing and HIV treatments in South Africa were shaped by poverty, stigma, and inequality. I also saw firsthand, though, how patients and healthcare professionals could work together to campaign for change and overcome these challenges. Now working as a GP in Shetland, I'm proud of the work that we do in the NHS and the kind and thoughtful care we give to our patients. However, I also see every day how limited and sometimes harmful our interventions can be in terms of over-ordering investigations and prescribing medications for many of our patients. Some of the healthcare that we provide today is inefficient, low value and unsustainable. And unsustainable healthcare is not realistic healthcare. One of the biggest threats that I see to health in local communities is loneliness and social isolation. We need connected and nurturing communities that promote and support healthier lifestyles. The volunteers at the local community shop where I live in Bigton are worth their weight in gold for safeguarding the health of our local community. They provide a place of welcome and support, connecting young and old, making sure the vulnerable are not forgotten, and providing meaning and purpose to those who volunteer. At Leavenwick Surgery, where I work, we set up local walking and gardening groups to which we've been directing our patients. The gardening group have transformed the green spaces around the surgery and the neighbouring care home and have transformed an overgrown walled garden into a beautiful space with wheelchair accessible paths and seating. It's heartening to see so many of our staff, patients and carers enjoy the use of this space and benefiting from a connection to nature and community. Our weekly walking groups have been running for 2.5 years now, and so many people who come have said just what a positive effect it's had on their lives. One walker told me how attending the weekly walks after spending months shielding during the COVID lockdown had really transformed her life. Not only has she regained her physical fitness and her confidence, she's made so many new friends, and I've seen what positivity and joy and humour she's brought to the rest of the group. The actions inspired by the Greener Practice Collective have shown me in so many ways the impact that healthcare professionals can have at an individual level as well as at a community level. There is much that we can do to decarbonise our practice and make our systems more sustainable. But we also need to reshape the focus of healthcare on not just treating disease, but on actually promoting health. We need to move from a model of bureaucratic care to relational care. That is kind, careful care, where we focus on what matters. One patient recently told me that when you go to the doctors, you expect to come away with a series of tests, some pills or a referral. And of course, these have a role to play. But I'd say that good health is much more about feeling deeply connected to yourself, to nature and to your community. Healthcare professionals have a really important role in recognising and facilitating this. In this chapter, the Chief Medical Officer will share his reflections on the planetary crisis, how it will affect our health, how we need to mitigate and adapt, how we need to reduce, reuse and recycle at every level of the service, and our role as anchor institutions in role modelling best practice and supporting our communities to face the challenges.
My name is Anna Dominiczak. I'm Chief Scientist for Health for the Scottish Government, and today we're talking about Chief Scientist Office and our experience in research and innovation in health across Scotland. At the end of last year, and to be precise, on the 31st of October 2023, Chief Scientist Office celebrated our 50 years in existence and 50 years of promoting research and innovation across the NHS and academia. and with focus on collaboration, working together, bringing innovations that help patients and communities, that help all of us in Scotland to live healthy lives. I think 2024, this 51st year of our activity, brings huge opportunities for Scotland. I think implementing, adopting research and innovation, the evidence that research brings to innovate in health, both in primary care, in secondary care, and perhaps most importantly in prevention, in the community, working with colleagues in digital and data across Scotland, bringing new ways of doing things. And just to give you a few examples, the work funded by Chief Scientist Office has brought revolution to looking at chest x-rays, something very simple that in medicine we have done for years. We can now do better and faster by using AI and machine learning. These type of translational approaches, bringing discoveries from Scottish universities to try it really in the clinic, from bench to bedside and into community, is what we need to do now. We also do a huge effort to train and help health innovators of the future. And this is why we have innovation fellowships, the ability for entrepreneurial colleagues across the NHS and academia to engage with industry, to do new things, to do this translation and adoption of new discoveries into our NHS to serve patients. So I think this report, Chief Medical Officer report, is helping us to stress the role of research and innovation in everything we do across health, the NHS, the academia, our clinician scientists across the board. And I think together we can bring to Scotland and the world the best possible and most efficient health innovations. This type of investment in people, ideas, will bring better health to us all. Thank you very much.
Hello, I'm Dr. Fatim Lakha. I'm a consultant in public health medicine and have both a national and a local role in that I work with Public Health Scotland and NHS Tayside. Today, I'd like to talk about the health of the nation. Health and well-being are fundamental to a flourishing society. For decades, life expectancy in Scotland increased. This was influenced by improvements in working and living conditions and medical advances. However, since the 2010s, Scotland's health gains have stalled. Many measures of illness are now worsening. Differences in health outcomes between social groups are widening, and our population is ageing. The Scottish Burden of Disease study predicts that at current rates of illness, population ageing alone will result in a 21% rise in disease burden by 2043. It doesn't have to be this way. Success in the past shows us that change is possible. In the last 2 decades, Scotland has implemented world-leading public health legislation, including the ban on smoking in enclosed public spaces, the virtual eradication of hepatitis C, and minimum unit pricing for alcohol. These policies, which have prevention at their very heart, have saved lives. They show that we can deliver policies that impact positively on health. Yet, tackling health-harming products alone is not enough to address the fundamental causes of inequality and poor health. What makes the biggest difference to our population's health are what we call the building blocks of good health. These include adequate income, good quality employment, good housing, sustainable transport, access to healthy goods and services, and a healthy environment. It's really important that all parts of society work together to ensure that everyone has access to these good building blocks of health. Partnership working and policies across all sectors is absolutely essential to deliver change, to reverse the negative trends we see today, and to create better health for the future. Thank you.
Mitigating and adapting to the planetary crisis must be our #1 concern as we work towards our climate resilient, low carbon, equitable and sustainable health and care system of the future. We must act quickly, collectively and decisively. Our aim as health and care professionals must be the enrichment of life if we are to improve health and well-being. Through careful and kind care, we can promote more sustainable health care for the people that we care for, our communities, and to help reduce the impact of healthcare on our environment. When we consider the size of the task we are facing, it might feel daunting, and the action needed may seem beyond our personal influence. But taking care is fundamental to our practice, being careful and being kind. It's obvious to me that we have a pressing need to do things differently, and I remain convinced that practicing realistic medicine will help us to respond, to adapt, and to deliver the change needed for our communities and our planet to thrive. This will require a sustained effort across all sectors, clear leadership at all levels, and a firm commitment to strengthening our local and our professional communities. I'd encourage each one of you to think about how we can break down the complexity into small, manageable improvements. If each of us can take this forward and hold on to the principle of finding out and delivering what matters to the people that we care for, I'm confident that we can create a society where everybody thrives.